when did you start coming to us to help you with your teeth?
Over a year ago, I think.
Yeah.
Just probably a year and a few months.
Yeah. So why did you need dental help?
I had healthy teeth for a very long time, and then my teeth started to wear real bad from grinding. I was diagnosed with real bad TMJ, and from also just nutritional deficiencies and other things. And so when my enamel went, my bite was terrible. I was in a lot of pain, and the first reason is it just looked terrible. And it actually affected not only, I mean, I couldn't just keep my mouth closed because you could actually see that my jaw wasn't shutting right.
Right.
So
How did that make
there are
you
many
feel?
reasons, and I couldn't eat.
Couldn't eat.
Yeah.
That's a big deal.
Couldn't eat normal.
Yeah.
So I actually was returned to the baby food aisle at the ripe age of 30.
Yeah.
So, which was kind of silly.
Yeah. So what were you looking to have happen, like as an end result?
I couldn't really fathom it, but I would have liked to have had a regular bite, teeth that functioned well, and to be able to reside at the end of the night and not have a constant ache in my jaw joints and such. So from everything wiggling around awkwardly. So that's what I was hoping for, and to be able to just not have people say, hey, you know, we're taking a picture, be sure to do a no teeth smile, you know.
Aww.
Yeah, that was something that became all too common.
Tell us about the process and what you currently, the end result.
Well, Dr. Coates was very adamant about making sure that we're going to not just put pretty whiteys all over and with sharp ends and send me off, but make sure that my jaw and was going to be closing properly. And so what we did is we took a lot of different measurements, and to do that we used some different devices, and we took what we would do is we'd use temporary and put kind of something like a casting, and we put those across the teeth, and we kind of experimented and adjusted and saw how my muscles would adapt instead of just throwing things on there and just assuming and telling the muscles, hey, you know, hang out with that. And so what we did is we were aware of any problems. We kind of like watched out and saw how the body would receive it and what we needed to do to finally construct those permanent crowns to put them all around to hold things properly. So there were probably three main stages.
Yeah.
So
those temporaries that you were talking about, that was called like an orthotic. So did they look like teeth?
Yeah, they looked like teeth, and they functioned a lot like teeth. And I was immediately complimented by people just with that temporary orthotic, and I was like, well, hey, hold your horses, because this is just the beginning. So, I came back and had that adjusted a couple times, and goodness, the next stage was...
Then he had them all like done at the same time, right?
Right,
yeah.
Right. We had all the teeth. It was that was the next stage. It was already, after with the temporary, which I was able to go with for quite a while, and it was very comfortable. I didn't have to take it in, take it out, do anything silly. Very easy, very manageable. After that, we came in and did some more really good measurements, and had all the teeth prepped to get ready for those permanent crowns to go in.
Right.
And I left that appointment with another, was that called an orthotic as well, or it was called temporaries, right?
Yeah, that was your full-mouthed temporaries. Yes.
Yeah. I left that appointment with something that was even better than that orthotic had been, and it looked just as the permanent crowns would look like, and almost just like the permanent crowns. But I even got more compliments, and it was even better for my jaw. The bite held even better, and I could feel those muscles starting to relax and readjust. And I left there, that appointment, and that was called the temporaries. And it was a temporary of what the permanents were going to be. So.
And then what, like now that you're finished and everything is complete, like someone that was just starting this journey, like when you get to the end, did it make sense, all the steps along the way?
Oh yeah, it very, very, in fact it seems almost too simple. I thought just now, kind of recounting it, that there was another step in there, but there wasn't. It was so basically we had the orthotic, we took measurements, and then we started with the permanent crowns. And again, after the temporaries, I came back and we took that off and put in all individual crowns and made sure those adjustments in the bites was great with that, and that was real easy. So everything's been great. It's been very simple. Things fell into place.
So now that you've had an opportunity to be with your family and take pictures, how do you feel now being able to smile the way that you want?
Oh, it's great. It's I guess what I can say is not thinking about it is the best blessing. So just not being cautious of something and having the energy go to, oh gosh, not only what am I going to eat, but how am I going to feel when I approach these people or those people. The worst thing was my half-sister, her two boys. My mom told me not to smile and talk to them a lot because they would be so astonished. My two little nephews, because my teeth were so bad. And so they came to visit. They don't live far from here. They visit probably every few months. They came to visit, and it wasn't even an issue. It wasn't even anything I talked about. I was happy. We smiled, and that was a real big blessing. So that's another great thing. I don't feel like someone who has to say, "Yeah, I got this job done."
Yeah.
I feel like someone who has a restoration of my true self, and not only what you can see of my true teeth, but a restoration of what's true to my bite and my alignment and my muscles and everything in my face, the structure of me. So it's really nice. I mean, it's nice not to feel that like I had something unnatural done to fix a problem, but I had a restoration back to who I really am, and it looks great. And what's also is it's almost supernatural. So.
Thank you, Patrick. Thank you for explaining your journey about full mouth restoration.